my name is Elizabeth, and I will be doing my demonstration speech. For my demonstration speech, I will be showing you how to do CPR. I think CPR is a really important skill to have, especially if you're a parent or if you're in a job field that requires you helping other people. It seems like such a simple skill, but it might be something that you might have to face anytime during your life. So to start CPR, the first thing you want to do is call 911. It's going to take a couple minutes for the EMT to arrive, and that's where CPR plays an important role because that could be what saves the person's life. So you want to check if they're breathing and if there's something lodged in their mouth. If there's something lodged in their mouth, you want to take your index finger in a hook form and swoop the object to remove it from their mouth. So to start CPR, you want to place one hand, the palm of your hand on the breastbone in the center of their chest, and your other hand will go on top with interlocking fingers. Then you want to adjust yourself over where your hands are, and that's when you'll start your compressions. You want to do compressions at the speed of about 100 to 120 compressions per minute, and you want to be pressing in about 2 to 2.5 inches. Doing compressions is pretty hard on the body, and you do risk breaking their ribs, but that's when it comes to breaking ribs or saving a life. So when you do compressions, you want to use your body weight, not just the weight of your arms. And then after you do your compressions, you're going to want to do 2 breaths. So when you do your 2 breaths, you want to tilt the head back with 2 fingers under the chin, and then you want to plug their nose. When you do your breaths, you want to look at their chest to make sure their chest is rising, and that is how you know that you're properly doing your 2 breaths. You're going to keep going back and forth, switching between 30 compressions and 2 breaths until the EMT arrives. When they arrive, they will then take over. If this were an infant, you would not be using the palms of your hands, but instead you would just be using 2 fingers, and your breaths would be slightly lighter than what you would be using as an adult. I want to thank you for watching, and I hope that I was able to help you learn a little bit about CPR, and hopefully you never have to use this in the future. I have to show my